This is Kenya from Spiritual Vitamin C, the podcast. Truth alert. Living for God is the biggest win. Knowing how? Now that's the question. Story by story, we present and break down God's holy word and give practical tips on how to apply kingdom principles today. So stay tuned. This is Kenya from Spiritual Vitamin C, the podcast. I pray that you are well on today, no matter what day this is for you, whether it's your beginning of the week or the middle of the week or the end of the week. I want to say, I pray that you're doing well. And if not, my prayers are up for you on today, that God will give you grace to make it through whatever it is you may be facing as you are listening to this podcast, Spiritual Vitamin C, the podcast. We are deep in the heart of the month of May, and we are continuing our series entitled Mind Your Mental Health. It is our attempt to honor National Mental Health Awareness Month, which was established in 1949 to raise awareness, to bring education, to bring information about all things mental health. So we have endeavored this month to do the same. We have brought on amazing mental health professionals that have helped us to understand what is mental health, its importance, the need for conversation, the need for tearing down myths that hold people back from getting services. We are endeavoring to destigmatize mental health. So far, we've had a pastor who was also a therapist. We've had LCSWs. Now, today, we are going to be talking about mental health and substance abuse and just mental health, the need for services. And with that, we have two amazing mental health workers who are amazing professionals doing what God has gifted them to do, and that is to champion the cause of mental health. And so we have Aristide, a clinical director at a WISE retreat. He's a substance abuse counselor. He has been instrumental in creating substance abuse and other mental health related programs. He graduated from the International University of Felix, HBU, in the Ivory Coast, with a bachelor in criminology, a master's in criminology, psychology, and sociology. He also has a bachelor and a master's in audit and management control. And also we have Marina, who is an amazing psychiatric physician assistant, a Psych PA. And she has a tremendous passion for expanding access to quality evidence-based psychiatric services for everyone. She completed her undergraduate studies at UC Santa Cruz with double bachelor degrees in neuroscience as well as in psychology. She completed her medical studies through Touro University, California, with double master's degree in PA studies and public health. She is currently in her first year of a part-time doctorate in medical science program. I want to say, let's welcome these two amazing mental health professionals as we embark on this conversation of all things mental health. And so, as you two amazing mental health professionals are on the screen, how are you doing today?
We're good. How about yourself?
Doing well.
Doing well. I'm so glad to see the both of you. It's like a 2-for-1. Both of you are masters in your own field. And I say that because to champion the cause of mental health is quite an undertaking. It has to be a love. It has to be a passion. And I just want to say thank you for doing so. Mental health is extremely important, especially in context of everything that's been happening with COVID. Just has ramped up. It showed us the necessity of making sure that our mental health is intact. And if it's not, to reach out and get services. So with that, who wants to go first? Tell the viewers of the podcast something about yourselves. Who wants to go first? Jordan or Marina?
So thank you for this platform at the beginning. Thank you, Kenya, for what you do. Your podcast bring a lot of light. Spiritual Vitamin C bring a lot of insight to the people who participate in that one. We actually very honored to be part of your mission today and what you do. We actually both joined this field by the love of helping other people, and that's what we try to do the best. That our gifting, that the gift we receive from God, and is a really a true passion doing that one. Yeah, and we're glad we can help more people.
I'm grateful that Spiritual Vitamin C listeners, whether it's the YouTube channel or the podcast, that they will be blessed by your gift. And so I'm grateful for the both of you taking the time aside from your busy schedule to pour into the listeners, not just those who will listen tomorrow or next week, but those who will listen. It'll be on record. And I'm very grateful that you all decided to turn aside and bless Spiritual Vitamin C, the podcast.
Yeah, we're both immigrants from countries that don't really believe in mental health services. And so it's important to us to spread the message as well as make people feel not as alone.
You said not as alone. Tell me, since COVID, what pre-COVID and then post-COVID, and not really post-COVID, pre-COVID and then now still in COVID, how has that changed your view with mental health?
I think that, first of all, the numbers of psychiatric as well as substance abuse issues has skyrocketed, especially depression, anxiety of adolescents as well as adults. Every substance disorder has really been increased by A, the isolation of COVID, B, the stresses, especially now with what's going on, with war in the world. We're definitely seeing increased numbers.
Wow. Okay. Pre-COVID, you had a treatment plan, how you practice, whether it's substance abuse use counselor, psych PA. Has your mind changed in how you practice now?
So, yes, it's for her the question, but I would like to add that pre-COVID, people has the occupation was helping them going through some emotion most of the time. When you're busy, you have a tendency to push down your anxiety or your depression. COVID showed everybody how time is important, and also to learn how to discover themselves. And this isolation and depression increased the number of substance abuse for people, and also the mental illness became more visible, more apparent, because there's nothing to do. You have to stay home. So the anxiety and the depression skyrocket. A lot of people lose their job. So the life was looking really difficult ahead. That created also some big anxiety and more depression for the family, not able to provide for themselves. Wow. So it definitely bring on the table a big point that we definitely need to look into it overall in the society, because the mental health part of society became a little bit too high on the number.
And not only that, but our homeless population has increased because people are losing their jobs. People are losing their insurances also because they're losing their jobs or because they cannot pay.
I didn't think about that.
As well as domestic violence rates have really gone up.
They have.
Mm-hmm.
Yes.
Wow. Okay. I think it makes sense, because you gotta express all of that somehow. It has to come out.
Yes. And
wow.
Unfortunately come out the wrong way.
Well, and people are more able to kind of isolate their families and hide what's going on, more so than, when we were out in society. And, somebody might notice a bruise. If you're staying home, it's, puts especially women and children, and also men that get abused, in a place where they're somebody else is less able to recognize their struggle.
Wow. I don't know. It takes multiple voices in the conversation to highlight all these different facets. I never would have thought about. I mean, I guess I've seen some things on the news, but I didn't really think about what you said, that when you're out in society, people see you. And so to cover up a bruise, you have to do a lot more work. But it never ever occurred to me that when you are at home, because you are isolated, that they don't, it's easier to continue the abuse because you're not around anybody. And so the work to have to cover up and to come up with an excuse is not there. Wow. That's huge.
Yes.
So now, Jordan, for you, the substance abuse part,
Mm-hmm.
pre-COVID, your treatment plan, did it adjust for you? Now that we're in the midst of COVID, is it the same?
It really, really drastically changed.
Okay.
Because the number is way higher than before. Because think about it, somebody have to go to work. He's not gonna be drunk every day, or he's not gonna use any substance every day, because he have to show up at work. He can be tested. But when you spend 1 year at home and there's nothing to do, the first thing people are leading to cover anxiety or depression is any kind of substance around them. They want to hide those feelings. So the number really, really increased. And on top of it, the homeless population increased because people lose their job. So that increased the number of depression, and they have a tendency to go use anything they can find to hide this depression or to better manage this depression. And also, mental illness was not as much popular before COVID, because less people was actually seeking help than now.
Okay.
They're actually realizing what's going on with them. Being stuck at home for 2 years really changed the way you see life, really changed a lot of mental process in most people. And people was going underlining any kind of illness. This illness show up now because you're facing stress, you're facing anxiety, and depression is present because you don't know what's tomorrow gonna bring it to you. So in that case, the substance abuse really, really increased. So everything changed. We have actually, thankfully, California got different programs to help those people, but more and more people need help. Way more and more people.
Okay.
Sorry, go ahead.
No, go ahead, Marina.
So to bounce off of that, I think both of our treatment planning has changed. We're taking into consideration more isolation, more, substance abuse, more domestic issues, right? Relationships were extremely tested. And so we do have to pay attention to environmental factors much more than even we did before.
Yes.
Okay. To both. Why did you go into mental health? Why Psych PA? Why substance abuse counselor? Why?
I think for me, immigrating to the United States really, from the Ukraine, really showed me that help is available, right? Not to everyone right now, but there is help out there, even if it's not accessible.
Okay.
But, I went through some struggles myself with mental health, and I felt alone, right? Nobody in my family knew about mental health treatment. It was not supported by our communities. So I vowed that I would make sure that none of my patients go through this journey alone.
For me, my story starts in the early No, at the end of 1990, early 1999, 1998, where I like to use the word discover. Is maybe not appropriate to discover that I had a cousin with autism and nobody knew about it. Nobody knew what was it. So he was secluded in a portion of the house where his mom was ashamed and was hiding him because she don't know what it was, and she think his kid was quote quote crazy. So one day, one summer, I went to visit and I turned to one of the room where nobody's supposed to go, and he was there, isolated by himself, and nobody knew about it. And he was already 16, 17 years old. So imagine somebody living like that for the past 16 or 17 years old was a pain for me. And I take a mission to find out what was going on with him. That's how I approached the psychiatric department to my university. And I met a really, really great teacher, Mr. Asemia Nyamie, who told me about it. And it brought to me this flame to want to know more and want to help more people. The outcome of that one is he received help like he's supposed to, but that directly connect me to the mental health. And the substance abuse came along the way where some family member fall under this bracket. They start abusing substance and help wasn't available. They didn't know what to do. And I directly started liking, and it became my passion. And on top of it, I think my mom had a part to play in there. Why? Because I remember early on when I start actually my training, my university course for mental health, she sent us to the prison where we met the inmate to hear the story. And most of them was regretting ever meet or cross the path of alcohol or drug, and the rest of their life you have to spend behind bar because under the influence they made a mistake. So that, for me, my goal is to help more people before they get to this point.
Wow.
You know? Yeah.
Those are some serious stories. Like, the beauty of this our own struggles is what I'm realizing is those become the motivating factors, and those are like the drives that keep us going when it seems like, can I ever get through school, or if I'm up against something. Those are like, it's kind of like beauty for ashes. God has a way of helping us like package all of this hurt and pain, and didn't have services available, and cousin was locked up in a room and no one knew about it, but allow us to purposely reach more people. Because of what we've gone through, we are more emboldened to champion the cause because of what we've gone through. And so I am very grateful, truly, that Marina, I had no idea. Ukraine, I mean, like, the stuff that, like, right in the middle of war. Thank you for being a part today. And Jordan, just, a cousin that you didn't know about for years. Thank you for letting not only myself, but those who will be a benefactor of your experience. Thank you for sharing that today. So, substance use, substance abuse, are those interchangeable?
It depends of how you look at the situation, because
Okay.
substance use, you need education for that to don't turn as abuse. It's commonly used to talk about the same, let's say, disease, because addiction is a disease. So substance abuse is when you lose the control.
Okay.
A substance use is what you use. We try to prevent you to use the control. Let's say the case of somebody got a car accident and you need to use some painkiller. We have to educate this person because it's really likely to switch from painkiller to opioid.
Oh.
Because abusing those medicine, they come as an opioid because they are kind of look at the same and act at the same in the body. If you use the case of narco, to give an example, if you abuse of it, you become addicted to it. But if you use that properly, you receive the help actually intended for. So that's why we mention that differently like that. Substance use, you need education. Substance abuse, you already lose the control of what you're taking.
Okay. That makes
Um,
wow. Go ahead,
yeah.
Marina.
Also, and so our psychiatry Bible is called the DSM. And in the DSM, substance use is not listed, right? Substance use, you can use alcohol, you can use, in the case of California, cannabis, marijuana, and use it sporadically or use it, at a frequency that is not interfering with your life. Substance abuse, there have to be negative consequences, right?
Okay.
So it can impact relationships, it can impact work, school, whatever. And you keep using despite those negative consequences.
Okay. Thank you, because every time I saw it, I was kind of confused. Like, do I use substance abuse or is it substance use? Okay. Now we know. Mental health, mental illness. Is there a difference?
So I really don't like the term mental illness
Okay.
because it puts a negative connotation to those people that are struggling with mental health, right? Illness is something that's frowned upon, something that nobody wants to get, something that, signifies that you're diseased.
Okay.
And so really what we like to use are mental health conditions.
Okay.
Disorders also place that negative connotation. And so it becomes the opposite of mental health instead of something to strive towards.
Okay.
And those words used, mental health illness or disease, make people ashamed or feeling guilty to seek for help. So in that case, that creates more and more people abusing substance because they auto-medicate themselves because they're ashamed to come and say, "Hey, I have an anxiety disorder or a depression, constant depression." So they're seeking help towards substance, and that increases the number of abuse of substance also. That we're changing the way we call really good bring a better impact and better opening to those people to reach for help.
Okay. So mental health conditions is
Yes,
is that's the preferred mental
yes.
health conditions. Okay.
Psychiatric conditions is also.
Okay.
It sounds better than disease.
Yes, or illness. And even I was talking with I interviewed a pastor who was also a therapist, and he mentioned the same thing, that disease, like that just it just sounds bad, or even illness, that sounds just terrible. So yeah, anything that can tear down, destigmatize mental health, like I'm all for it. Why is mental health so stigmatized?
Let's say the population, the community in every aspect need more learning about it
Okay.
because people don't know exactly what's going on, and it was so for so long called mental health illness, and illness means something really bad, like people actually scared to reach for help. It's like when you tell somebody you got cancer, respectfully, is you need the support of the older family to make you understand you can fight through it. But they actually take that as a terminal level, but you can actually fight through it. So mental health condition, if the population, if the community is educated about it, they
Okay.
can actually receive help. They can seek help at the early stage before it kind of go a little bit out of control or lead you to abuse any kind of substance.
I think also, for some reason, people think that, diabetes is something that is not in your control, right? Cancer, you didn't ask for cancer. Let's say, liver disease.
Okay.
It is something that happened to your body, where people think that mental health, because it is your brain, you should be able to control it. And
go ahead. No, I was going to say, why the double standard? Because it is a double standard, right? There's just numerous commercials about this medication for when you have, PE or maybe you have heart conditions or so and so and so. But I feel like when it comes to mental health, I don't know, it's just even the commercials are different. So why?
Because I think it's too scary for people to recognize that this could happen to anybody. We want to have this notion that we are able to control our brain. Right. We are able to control whether we get dementia. We are able to control whether, we have hallucinations, where in fact, that belief is actually very detrimental.
Wow. Okay. Wow. Fear. Marina, you mentioned adolescents. Do you treat adolescents?
Yeah, we treat everyone along the lifespan.
Okay. Teenagers, children, how is the outlook? How do they come in and present to you? And I mean, just even their ability to accept mental illness.
It's really interesting because we say that parents are a lot harder to deal with than the actual, children or teenage patients. Because I think we underplay the role of environment in childhood mental conditions, right? A lot of the time, what we see is trauma that kind of gives way to other things like anxiety, like depression.
Okay.
And so by ignoring the environment that the children are in, we're labeling them with all sorts of disorders that they don't have.
Wow. Going back to adolescents or teens. So you say a lot of their stuff is environmental?
And not everything, right? There's very much a biopsychosocial framework to psychiatry. And so, depression, anxiety, we know that some of it is genetic.
So what you're saying is some of it also is environmental.
So a lot of the time what needs to happen is that genes need to meet environment that fosters the genes.
Okay.
And
Wow.
so let's say somebody is genetically prone to depression. But if you put that person that is prone to depression in a depressing environment, how could they not be depressed?
Okay.
PTSD also play a big factor in those mental illness, because PTSD is a factor we sometimes disregard, but it's really important, because what happened to you at the early age can morph your behavior when you became adolescent or when you became adult. Because the PTSD creates a rebound in the future of how you react depending on the situation. When you see most of the people with substance abuse, most of them have a past with trauma. And the substance abuse was the response to this feeling and this emotion they don't understand. So that also acts, and that also is the consequence, can create a lot of mental health condition. Whatever, if you don't have that in your gene, a trauma at the early age can create the mental health condition in the future.
Yeah, and I think it's important to know that trauma has neurological effects on your brain. And so I think that our society thinks that trauma is limited to childhood, right? Once a couple of months, a couple of weeks passes, we should just get over it. Where in fact, what happens is that trauma changes your brain. It puts you in fight or flight mode for as long as you don't address it.
I know it's true just in just my own life, and just, there's so many layers, right? That, just a Black woman and you can go on forever.
I don't think a lot of society realizes that microaggressions and racial, and racism and just everyday interactions are trauma.
Yeah. To change your behavior.
The trauma it will remain until it is addressed.
Yes.
So if you think about it,
it makes sense. Wow.
So a trauma happens, right? It's really big when it happens. you have a lot of symptoms. And then as time goes on, right, that trauma can shrink, especially if you get therapy or take medications, hopefully both. So it shrinks, but every time you're triggered, it's activated almost to the point where it was when it originally happened.
Okay.
And then it can shrink back down, and this kind of cycle continues. Even people who get treatment, right, who go to therapy, can sometimes be triggered to a point where it's reactivated, right? That's what flashbacks, nightmares, that's what that is about. And I think both of us are really cognizant of trauma. Definitely. And how it can affect a person, because it's something that's not at all addressed in society right now.
We don't address, we just keep moving because we have to.
That's and more of your behavior for the future events. Yeah, that's the problem about it.
Wow.
Let's put that in a picture. Let's say you're a kid growing in a family where the parent always yell at him and put him down and don't encourage him on anything he does. He creates this depression. It was never going to be addressed, and he's going to grow with it. And we're going to see further in the future a low self-esteem, because nobody never helped him, and low self-esteem and depression and anxiety to do everything, because everything you've been doing at a young age, you've been yelled at, and everybody, they say it was wrong all the time. So you're not going to be able to take really good decision for yourself. And the more the depression is there, if in an instance the situation appear to you, you're going to go directly to substance abuse. And you have this condition growing, you don't know what is it, and you don't want to reach for help. So you hide yourself behind the substance abuse of it and make your condition worse. It's like the hamster wheel. You get stuck in there. You're reaching to help to the substance, but the substance creates a deeper condition. So you're stuck in a hamster wheel, going in circle in the same place. And those are something we need to address also.
And I also think that people think that substance abuse is under somebody's control, right? The DSM specifically says that it is out of your control.
It is.
And therefore, it is not, like society thinks, something that you just should be able to stop doing. Substance abuse is a symptom of a larger problem.
It is true. When you don't have that understanding with substance abuse, that you should just be able to get over it and keep moving. But it's layered. It's not just what you see, but it's everything under, kind of like the iceberg example. Like you only see the tip, but you don't see everything else that's under it. For those who are listening, who may be battling with substance abuse, substance use, mental health condition, how can they fight through all that they've been told about not to seek help, or if you do, you're weak, or if you do, you're telling your business, whatever? How can they fight through to get to somebody like you?
So I would like to, first of all, let them know they're valuable. Everybody on earth is valuable. You have value. And because of that, you're entitled to reach for help. There's help available, and there's people for you. So the earlier you reach for help, the better you will feel faster, right? So do not judge yourself. Do not be desperate. There's always a way to help you. Just reach for help and understand you're valuable.
There are also resources online that you can look at. And this is a perfect example of a terrible name, the National Alliance on Mental Illness, NAMI. If you go just type in NAMI.org, you'll be able to find services near you. There are also community clinics that can point you in the direction of free services. Therapists often take people on a sliding scale that, pay what they can pay. A good way, Psychology Today, for example, psychologytoday.com, you can search for a therapist in your area, and it'll give you a list that you can further refine by certain criteria.
Okay.
And so those are all good places to look. But if you don't know where to look, that becomes an issue that can affect the rest of your life.
Okay. What if someone wants to get to you? Are you available? Can they reach out to you?
At the moment, if anybody got abuse substance or difficulty managing the substance he abuse, you can contact A Wise Retreat. You type online, A Wise Retreat is a nice environment set up in Vallejo and Benicia. And he's only men, the one open now, but we have a women facility opening very soon as well. And I think at this point you can reach me over there. Also, Sonoma Valley Hospital also. I work on the ER department over there. You can reach me there, especially on the weekend.
Okay.
Anybody can reach me at our website. I currently work at Sion Clinical. It's a clinic which accepts everybody throughout the childhood, adolescence, adulthood. We also offer telehealth services. We have psychiatrists, nurse practitioners, PAs on staff, which can prescribe medications and do some therapy. We have therapists on staff. We have medical assisted treatment services, meaning that your Suboxone, your let's say anti-abuse, things to help you stop using substances.
Okay. And so for those listening or viewing, know that their information will be linked in the episode description. So you will be able to reach out to them should you desire to. And I want to say, both of you, Marina and Jordan, thank you so much for turning aside from busy schedules and blessing Spiritual Vitamin C, the podcast, with your information. And wow, like this whole conversation, I'm grateful that it's on record, because there's just some really powerful truths that have been put to light for us here. And so I'm really grateful that you are here on today. All right. And so I am so grateful for Marina and Jordan. Marina is a psychiatric PA and Jordan is a substance abuse counselor. And once again, for those of you who may be listening or viewing, all their information is going to be linked in the show notes. I would ask that you would please rate Spiritual Vitamin C, the podcast, that you would please consider subscribing, that you would consider those who are on YouTube, if you would please consider subscribing to the channel so that anytime an upload comes, you are the first to be notified. Once again, thank you for joining me today on Spiritual Vitamin C, the podcast. Please remember that life needs a dose of Christ. If you enjoyed this episode of Spiritual Vitamin C, please subscribe. I would also love it if you would rate it and leave a review. I look forward to seeing you next time. And remember, life needs a dose of Christ.